Hi everybody, Becky Strayer here with Naya Clinics, and in today's video I'll be talking about what to expect the first time you go to therapy. A lot of times the first time in therapy is pretty intimidating, so through this video I'm hoping to alleviate any fears you might have and answer some of the common questions we have about what going to therapy is all about. Through our practice with Naya Clinics, if you book an appointment, right away you'll get an email that gives you access to what we call the client portal. And through the client portal, you'll be able to get all the paperwork that you would need to fill out before meeting with us for the first session. And so in doing this, you'll get the forms such as informed consent, the social media form, and our social media policy, as well as our cancellation policy and fee agreement. And there will also be an intake questionnaire that you can fill out as well. On this intake questionnaire, I'll have questions such as what's bringing you in, have you ever been to counseling before, to a little bit more of the serious questions like substance abuse history, any suicidal thoughts, any thoughts of harming yourself or others, things like that. This gives us a pretty good kind of background about what's going on, and so whenever you're filling that out, feel free to fill out as much as you're comfortable with. We understand that, especially if this is your first time in counseling, it is pretty vulnerable to put out all this information to someone you don't really know yet, so share as much as you're comfortable with. And the same is true in your first session. We don't expect you to tell us your deepest, darkest secret. We understand we're still a stranger at this point. And it takes time to build up that therapeutic trust and therapeutic relationship. So that's okay to not divulge every piece of information right away. That's all right. And so after you fill out all those forms, you're ready for your first session. Before we meet, we do need those forms to be filled out, especially the informed consent that allows us to meet with you. During the first session, typically, at least for me, I know that typically the first 5 to 15 minutes is spent with me talking and kind of going over the background information, which a lot of it was on the forms that you already filled out, but making sure that we're clear on everything. I go over confidentiality, which is very important to the therapeutic relationship. So confidentiality is all about what we talk about stays between us. Legally, I'm not allowed to talk to anybody else about it. And that way, too, we can build up that therapeutic trust that I've mentioned before. And it's also nice to just be able to say what we truly feel, what's been going on, without fear of who's going to hear this and how is this going to be taken the wrong way, and things like that. I also go over whenever we absolutely do need to breach confidentiality. And with that, for every therapist, a licensed professional clinical counselor at least, we are also mandated reporters, so we do have to breach confidentiality if you're talking about hurting or killing yourself or someone else, if it's court-ordered, or if there's child abuse, elder abuse, or abuse of the disabled. I always tell my clients, you're never going to leave my office without knowing what's going on. We'll always discuss that and make sure that we're on the same page as far as that goes. I also go over the rest of the informed consent, so that's the benefits, the possible risks of therapy, knowing that sometimes people do tend to get worse before they get better, especially if we're talking about some things that are a little bit deeper or some of the more vulnerable topics that we haven't necessarily gone into lately. That, like the fee agreements, things like that, cancellation policy, and what to really expect in counseling, as well as my background too, and my education background, and my treatment modalities I tend to use, which for me, I usually tell my clients that I do a mix of what we consider the typical talk therapy, as well as some skills-based use such as cognitive behavioral therapy and dialectical behavior therapy. And I go over what those are and how we can kind of interact with those through the therapy process. I also always talk to my clients too about, if you feel like we're not a good fit, let your therapist know that. You're not going to offend us, and if you do, that's okay. You're not here for us, you're here for you. And the most important thing is that you're getting the support you need, you're getting the guidance that you need at that point. what's great about our organization is that if you feel like we aren't a good fit, we have other therapists through Naya clinics that are also um, trained very similarly, however, have different personalities. So they're typically a really good fit if we don't end up working out super well. Um, so yeah, never be afraid to tell your therapist, hey, I feel like I'm not getting what I need out of this. And then after we go through all the informed consent, answer any questions you might have, and kind of go over more of the logistics side of therapy, then we go into what's actually bringing you into therapy. And at this point, it's mostly going to be the client talking, where it's just sharing the information that's bringing you in, what symptoms have you been experiencing, stressors, and a lot of times too, I'll help guide it through whether it was the intake questionnaire and some of the things you might have answered on that, um, or just general questions I might have as well. Um, and it's mostly just to gather as much information. Typically, I'll also go over what have you tried before, and that way we aren't doing the same thing over and over and over again. And so the first session is very much just getting to know each other, kind of figuring out what the game plan will be, and that's also typically what I do in the first session. Will be, if we have time at the end, we'll go over kind of an informal treatment plan as far as what are your goals in treatment, what are you hoping to get out of therapy, and how can we accomplish that. Um, and so that's pretty much the first session. And then after that, we work off of your treatment plan for the most part. Yeah. So I hope this hopefully helped alleviate any fears you might have about counseling. Keep in mind, a lot of therapists also have been in therapy themselves. That's something that a lot of grad schools are now pushing, is that therapists also receive their own therapy. That way we can also see what it's like to be on the other side. And I know for a lot of myself and a lot of the therapists that are at Naya clinics, we're very big on you're the expert in the room, you know yourself the best. We're just the ones that have some of the skills that we can kind of help hand to you so that you can grow and use the skills so that you can feel back in control of what's been going on and feel successful. So I hope this helped. And if you are interested in booking an appointment, you can do so over nayaclinics.com or samnabilcounseling.com. Look forward to seeing you again soon. Take care.
Hi everyone, I'll walk you really quickly through getting an appointment booked through our website. So if you go to nayaclinics.com and pick the city that you want to work with one of our clinicians in, you're going to be prompted to this screen, which gives you a list of all the offices in the area, including the video office, which is an online option. And so, for example, if you're in the Cincinnati area, you'll be able to pick the Blue Ash office or the Hyde Park office or the downtown Cincinnati office, the Westchester office, or the Florence, Kentucky office in northern Kentucky. And so when you have picked which one you want, just go click on New Client, which will take you to a list of all the therapists available, but that's across all locations. So when you have picked your therapist of choice, this will actually prompt you to only choose the locations where they are available after you have picked the service. So say here you want to do marriage counseling or couples counseling, you select that, it will give you the locations where this particular therapist is available. And if you were to pick that, I'm showing you here something very important. If you click on today, or you try to book an appointment with less than 48 hours, you're going to get this notification to call us to book the appointment. That's because we have a 48 hours cancellation policy. So to go through the entire process online, just pick a time that is more than 48 hours into the future, and you are not going to have this issue. So here, let's pick this one next week, and then you're going to be able to toggle between morning, afternoon, evening appointments. Only when they're available will they show up. And then very simply just pick the one that you want, which will prompt you to fill out some basic information, your name, and your email, which is very important because that's how we send you all your intake paperwork and also appointment reminders. So simply just fill that up. And also we require for online appointments or for online reservations a credit card on file. So when you're done filling out your name and your email and your phone number, you are going to go to this section of the page where you just give us your credit card information. We're going to keep that on file to process all your payments with. And if you want to use another payment method, you can do that. If you want to change the credit card on file, you can do that. We just require that we have one available at all times on file. And once you do that, it's just click continue, and you should be set.